Experts continue to speculate about when COVID restrictions can be eased and we can return to a degree of normalcy. A new article in The Atlantic says that could be coming soon in a, quote, quite possibly wonderful summer. The article says the summer of 2021 may feel like the pandemic is behind us, with an increase in vaccinations and a drop in cases. For more on this, I want to bring in Dr. James Hamblin. He's a staff writer at The Atlantic as well as a lecturer at Yale's School of Public Health and the co-host of the Social Distance podcast. Dr. Hamblin, welcome. Great to have you with us. Tell us, why do you think life may return to some sort of normalcy this summer? I mean, that's certainly music to a lot of people's ears. It almost sounds too good to be true.
Yeah, for the past year, I feel like I've been delivering a lot of messages of doom and gloom. And for the first time in a long time, I'm feeling pretty optimistic by what I'm seeing in terms of the cases, in terms of the rate of vaccination ramping up, in terms of high-risk populations getting protected, so death rates are falling even more quickly than cases. In some ways, I know life can never be normal again. We've lost so many people. So many people have suffered so much, and we don't want things to be quote unquote normal. Really, we need to learn from what's happened, and I think the world will be different in a lot of ways. But in terms of getting together with people you haven't been able to see in a long time, in terms of gathering specifically among vaccinated people and seeing some semblance of return to a social life, without masks, again, among vaccinated people, I think it's very likely to be a possibility for many, many millions of people.
That sounds very exciting, but I'm just curious, you're not worried about the variants we keep hearing about? I mean, could one of those variants disrupt this idea of a normal summer?
Yes, it could. I am worried about the variants. The way that they are able to transmit more quickly could mean we see a surge, and many experts believe we will see a surge in cases between now and summer, and that we need, that's all the more reason to not let up too soon, just because a lot of people are forecasting this horizon of the summer being pretty good. I think that's meant to be a sort of light at the end of the tunnel to pull us through, to help us remember that this is not forever. These precautions we're needing to take are not some endless decree, that there is light on the horizon. And if we can stick through it now, we can avoid, a really bad surge right now due to variants. And we just need to stay strong and keep focused on what lies not immediately ahead, but not too far ahead.
But doctor, aren't we facing sort of a rolling schedule of vaccinations? It's still not clear how long protection from the vaccinations lasts. I mean, the understanding is it will eventually become like a flu vaccine, correct? That we all need to get every year. So are we to expect these massive vaccination efforts to just be continuing indefinitely?
Well, that's one possibility, that we have to get it every year. We will likely have to get it at some interval again, especially if we don't do a great job of containing the spread globally, which leads to the rise of variants, which leads to evolution that can create strains that are able to, against which our vaccines are less effective. So, the degree to which we need to continue vaccinations in subsequent years is going to depend on how well we do with our rollout now, and how much we stay strong in terms of trying to prevent and suppress the virus. If we can drive it down globally to really low levels, that could change the picture in coming years in terms of how much virus is out there, how much it's mutating, how high the risk is that it can come back to a vaccinated population and with some new mutations, threaten vaccinated people and take away that sense of security which we have. But at least in the short term, to come back to the summer, people who are vaccinated now should absolutely expect that they will still be protected within that time frame. We know this vaccination shouldn't last forever, but it would be extremely unlikely that it would be become ineffective within that short period of time.
Okay, so keeping our eye on the short term and this golden summer that we may be able to enjoy, do you have any concerns that even if we do have a successful summer, it could be a very different story come fall and winter of 2021 when the colder temperatures come back and people head back indoors? You know, could COVID-19 make a comeback this fall and spring? And I ask this fall and winter, and I ask specifically from the viewpoint of a parent who would love to hear that kids are going to be back in school next September, but I'm still not that optimistic.
I'm optimistic that they will be. I think we can't get complacent, and it's up to us how big the surge in the next winter will be. I expect that there would be one, but the most likely thing is, we'll definitely have at least a large percentage of the population vaccinated. We'll definitely have especially high percentages of vulnerable people vaccinated. So the more likely thing and the more difficult thing to deal with is we'll see lower numbers than we did last winter. There won't be a clear catastrophic situation where people's attention is, obviously demanded. And we might get complacent where we are allowing a still very high number of deaths, but considering it in the context of what we've just been through, thinking it's okay. So there are really difficult decisions ahead in terms of, what are the levels where you can consider the pandemic over. It's not going to be zero. When do you, really reopen things when there are still hundreds, maybe even thousands of people who are losing their lives, as that fades from daily to weekly? It's easy to lose track of those numbers and what they really mean and the people behind them. But I don't think next fall and winter will look nearly as bad as this past fall and winter did if we stay strong now, and if we get vaccinated between now and the summer, and encourage, family, friends, anyone who's hesitant or has questions, to sit down and hear them out and do everything you can to make sure your community is all getting vaccinated as close to 100% as possible.
Absolutely. And what you say sounds wonderful. A dose of optimism, well needed. Dr. James Hamblin, thank you so much for joining us.
Thank you for having me.